My name is Dr. Fiona McGillicuddy. I work in the School of Medicine in UCD and my area of expertise is in the obesity field. Obesity is currently a worldwide epidemic. 2.2 billion people worldwide are obese. In Ireland, 20% of the adult population are obese. 10% of children are obese. And actually Ireland's predicted to be the most obese nation in Europe by 2030, with levels rising to as high as 50%. And with that comes the problems of its associated diseases such as type 2 diabetes, heart disease and cancer. So we broadly categorise obese patients into two groups. A metabolically healthy group, about 40% of obese people are in that group and they require minimal intervention. And about 60% currently fall into a metabolically unhealthy group and they're at higher risk of developing all the associated diseases. We know now that inflammation plays a critical role in driving the associated diseases of obesity. And this inflammation is a little different to when you have a cold or a flu in that it's a very low level inflammation. And that makes it a little difficult to detect the inflammatory markers in circulation. At the moment, doctors routinely would do a blood test to look for different risk factors for heart disease, such as high LDL cholesterol, low HDL cholesterol, and they look for evidence of maybe pre-diabetes, such as high fasting glucose levels, but none of those directly measure that metabolic inflammation that we think is critical to causing the associated diseases. So I've created a new test which measures proteins specifically on HDL particles, and there are good cholesterol particles that float in blood. Normally in most healthy individuals, we have proteins that reduce inflammation on those particles. And that's very important because then these particles protect against heart disease. But what we've seen in the unhealthy obese individuals is that the particles switch in composition and they become pro-inflammatory. I actually think they might be driving heart disease in those people. If we try and measure the inflammation directly in blood, the levels of the inflammation are so low, it's just muddied with all the other proteins that are in blood. Whereas if we pull out this fraction from blood and look at the proteins directly on those particles, that's where we see the metabolic inflammation and we can measure it. And we're developing a test that will specifically target and measure those proteins. I think the really exciting thing about this test is that it's novel. It's the first time that metabolic inflammation will be able to be detected. It will give the clinician a very big overview of the health status of that patient and will aid in their decision making. We work closely with Professor Donald O'Shea in St. Vincent's Hospital with his obesity cohort, and it was actually in that cohort that we identified these proteins. We created a scoring algorithm based on all these proteins, and that's formed the basis, along with the proteins, of a patent that was filed last month. We're developing methods that will facilitate high throughput analysis of HDL-associated proteins, because that's the unique selling point of this product. And once we have this product developed, which should be in the next year, we're then going to validate into much larger cohorts. At the moment, our test is very specialised, it's time-consuming. So it's very important for us that we develop a new method to isolate the HDL that will facilitate much larger numbers of patients and also for the capacity for this test to go global. We're at a really critical point in our development in that in order to scale up, we're going to require more investment from investment companies. We're going to require partnerships with industry who might also avail of the test to identify patients who will respond to therapies that they have. And in order to do this, we need more researchers, lab facilities. We're hoping to spin out a company on the basis of these results. And ultimately, my goal is to impact on those 2.2 billion people who are obese worldwide.